It's been more than 2 years since Memorial Hospital in Pawtucket permanently closed.
And now we're getting our first look at the report about this closure. It outlines the impacts the hospital's closure had on the surrounding communities and the state.
Eyewitness News reporter Kim Kalunian joins us now with the findings in a story you'll see first here on Eyewitness News. Kim?
Well, Shannon and Mike, this long-delayed report now synthesizes what many folks have been saying anecdotally for years, that Memorial Hospital's closure had ripple effects on other area hospitals and removed access to health care for some of the state's most vulnerable residents. A new report by Boston-based John Snow Incorporated finds the closure of Memorial Hospital removed a nucleus of healthcare services for communities with high healthcare need. The report showing utilization of the Pawtucket Hospital's ER stayed steady, around 30,000 visits a year, even as inpatient visits sharply declined.
This is a really critical issue, and I think it's one of the reasons why the consultant named it as one of the primary needs as a result of this assessment.
The study says those within the hospital's service area of Central Falls, Pawtucket, and Cumberland are following a statewide trend and now using emergency rooms less. A potential reason outlined in the report, the target area population is foregoing emergency services when needed.
The reduction of emergency use throughout the state has been occurring for a large number of reasons, not just because Memorial closed.
Care New England CEO Dr. James Finale says the trend points to a larger goal of getting folks to use the emergency room less for primary care purposes. The question of whether a true emergency department will return to the area, not one Finale says he has to answer alone.
I think this is a community issue. This is a statewide issue. It's not just a Care New England responsibility to say that you need to put a hospital in that region that causes the whole rest of your organization to be financially challenged.
The report also outlining the impacts on other area hospitals, particularly a new influx of patients at the Miriam, resulting in increased wait times at the ER that sometimes result in patients leaving before being seen. Miriam's parent company, Lifespan, saying they've experienced a 30% increase in Medicaid visits since Memorial closed. A spokesperson saying in a statement, the closure removed critical health care services for communities with substantial health care needs and shifted the tremendous costs of caring for these populations from one healthcare system to another. Now, Finale disputes that Memorial's closure is what led to Lifespan's financial hurdles. Coming up new at 6, we ask what's next for the Memorial campus. For now, live in studio, I'm Kim Kalunian, Eyewitness News.
Only on Eyewitness News, we're getting a look at a long-delayed report on the impacts of Memorial Hospital's closure.
Among the findings, a ripple effect on area hospitals and a reduction in access to emergency services for some of the state's most vulnerable residents.
Eyewitness News reporter Kim Kalunian asked industry leaders what's next. She joins us now with what she learned. Kim?
Well, Shannon and Mike, there's currently a walk-in clinic at the site of the former hospital, but a lack of access to emergency care is the problem that health leaders will now try to tackle. As Memorial Hospital's inpatient numbers shrank, ER visits remained steady, around 30,000 per year. A new report by a Boston-based consulting firm says in the wake of Memorial's 2018 closure, those people are now overburdening other nearby hospitals like the Miriam or foregoing emergency treatment.
I'm not ignoring the fact that the ER at Memorial closed and folks used to come to the ER all the time. And we've taken care of that demographic, but it's not just C&E's responsibility, as the report points out.
Dr. James Finale is the CEO of Memorial's parent company, Care New England. We asked if a true ER could ever return to the site.
I'm not sure that an ER with all the attendant services that EMS could bring patients there in that region, I'm not sure it's financially solvable.
Finale says the property is under agreement to be acquired by New York-based Lockwood Development Partners, who plan to turn the site into VA housing. Finale says Care New England is considering an expansion of an existing urgent care facility on the campus, but he said they would likely not restore emergency services there. The Department of Health, meanwhile, is also looking at how to best move forward.
The report calls for all of us to dig into this area and think about certain recommendations, again, with stakeholders that we want to put forward in order to address this shortfall.
And the Department of Health says they're having conversations with community members about what's next. We'll have new reaction from Pawtucket Mayor Donald Grebian tonight on Eyewitness News at 10 and 11. For now, reporting live in studio, I'm Kim Kalunian, Eyewitness News.